When it comes to health, we usually think about like the regular stuff,
Hmm.
going to the doctor, maybe getting a prescription. But what if I told you there's some pretty effective solutions out there that are kind of outside the box?
Right. Sometimes the most impactful solutions aren't the ones we'd immediately think of.
Exactly. And that's what we're diving into today. Healthcare programs that might seem a little unconventional at first glance, but the evidence suggests they really can make a difference. We've got some fascinating sources on this. Programs that tackle things like addiction, but also ways to boost overall well-being, stuff you might not expect.
Absolutely. And we're going to break it all down, no jargon. Just trying to
Sure.
get to the heart of what these programs are, why they seem to work, and yeah, maybe why they sometimes stir up a bit of debate.
Okay, so let's start with one that definitely gets people talking. Heroin-assisted treatment, or H8AT. I mean, when you hear prescribing heroin, it kind of feels like the opposite of what we think of as addiction treatment.
I know, right? It definitely challenges the traditional view. But think about it, this is specifically for people struggling with chronic heroin addiction, people who haven't had success with other treatments like methadone. And what's wild is that studies actually show, for this specific group, providing pharmaceutical-grade heroin in a supervised medical setting can lead to better outcomes.
So better outcomes.
Yeah.
Like what specifically are we talking about here?
Well, for one, people are more likely to stick with treatment programs, which is huge. But also, and this might surprise you, they actually see a decrease in using illegal street heroin and even other illicit drugs. There's even some longer-term research showing improvements in things like physical and mental health and how people function socially, and even a decrease in cocaine use. It seems like the structured medical environment is a really crucial element.
That's fascinating. So the initial worry that this just fuels the addiction, that doesn't seem to hold up in these cases.
Yeah. That seems to be the case. Remember, we're talking about a very specific group here, long-term users who haven't responded to other treatments. And the research really points to this being safe and even cost-effective in the long run. If you think about it, reducing the harms associated with street drugs, things like overdoses and infectious diseases, well, that saves money and lives. And this isn't just a hunch. There have been multiple randomized controlled trials, the gold standard of research in Europe and Canada, consistently showing these positive effects.
So this begs the question, if the evidence is so strong, why isn't HAT more widespread? Why isn't it a more standard part of treatment?
You hit the nail on the head. I mean, there's a lot of emotion around this topic. Societal views about drug use are complex, and it's hard for some people to accept this type of treatment. Even with evidence suggesting it works, it challenges deep-seated beliefs.
Absolutely. It's definitely a complex issue. Okay, let's move on to another idea that sometimes sparks debate. Paying people to stay sober. I think a lot of people hear that and think, hold on, shouldn't this be about personal responsibility?
I get it. That's a very natural reaction. And it raises important questions about motivation and behavior change. But the research here is about whether offering financial rewards can be a tool, at least in the short term, to help people develop healthier habits.
Can you give us an example of how this looks in practice?
Sure. There was this really interesting study in India with cycle rickshaw drivers. They were given the option to put their earnings into an account that they could only access if they were sober. And get this, a lot of them chose this. They basically created their own financial incentive to stay sober. And guess what? The study found they drank less during the day and even saved more money.
Wow. That's such a creative way to use their own money as a motivator.
I know, right? And there was another study looking at people experiencing homelessness who also struggled with alcohol. They were offered job skills training, but here's the catch. They only got paid if they passed a breathalyzer test. And compared to a group who got the training without the sobriety requirement, they had way fewer positive tests.
Okay, so these incentives, they seem to work in the short term. But our source material does point out some controversy surrounding this approach. What are some of the key concerns?
Yeah. One big question is, are these external rewards sustainable? Will the changes last once the rewards stop? Some argue it's a helpful starting point, helping people achieve some initial sobriety, and that can lead to more internal motivation down the road. Others were skeptical. They wonder if it really addresses the underlying issues. And then there are the ethical considerations. Is it okay to use financial rewards in this way? These are all things researchers are continuing to explore.
Makes sense. Not a simple solution, that's for sure. Okay, let's shift gears and talk about supervised injection sites, sometimes called safe consumption spaces, or SES. Now, just to be clear, these are places where people can use drugs they already have, but they do it under the supervision of trained medical professionals.
Right. It's a public health approach. The goal is to reduce the harms that come with injection drug use. And studies show that these sites really do reach people who are actively injecting drugs, often people who are disconnected from regular healthcare. And it encourages safer practices.
What do you mean by safer practices? What does that look like in these settings?
So they provide sterile needles and syringes, show people how to inject more safely to reduce the risk of infections, and they're right there if an overdose happens. And this has been shown to drastically reduce the number of fatal overdoses. They also connect people to other services like addiction treatment, mental health support, and testing for HIV and hepatitis C. It's about meeting people where they're at.
Okay, but I know a lot of people worry that these sites will lead to increased drug use or crime in the surrounding areas. What does the research say about that?
That's a big one. And the research is pretty clear it doesn't happen. Studies consistently show that supervised injection sites do not increase drug use, drug dealing, or crime in the neighborhoods where they are. Actually, they often see the opposite, less public drug use and fewer discarded needles in public spaces. Even in New York City, a survey showed that most people who inject drugs would use a safe consumption site if it were available.
Our source material also mentions something called underground, unsanctioned, safe consumption spaces. Can you tell us about those?
Yeah, so these pop up in communities where there's a real need, but no official options are available. They can definitely provide a safer space right away, but they often lack the resources and connections that formally sanctioned sites have. So while they fill a gap, the evidence points to legally sanctioned, well-run sites being the most effective, especially for reaching the most vulnerable folks.
That makes sense.
Okay.
Okay, let's move on to something that sounds a bit less controversial but is gaining a lot of attention. Social prescribing. What is that exactly?
So picture this. You go to your doctor, and instead of handing you a prescription for medication, they suggest you join a gardening club or a walking group. That's social prescribing in a nutshell.
Interesting. So connecting people with activities and community support rather than just medical treatments.
Exactly. It starts with a referral, then you meet with someone who helps you figure out what activities in your community might be a good fit. Could be art classes, exercise programs, volunteering, even support groups.
So what's the thinking behind this? What are they hoping to achieve?
The big idea is to address the things in our lives that affect our health. Things like social isolation, loneliness, lack of activity. All those things are social determinants of health. They empower people to take charge of their well-being and build social connections. And some believe it can help people manage long-term health conditions and reduce reliance on medication.
It sounds like recognizing that our health is about more than just our physical body.
Right. And it's gaining traction. The NHS in England is actually putting a lot of resources into expanding these programs, and early research is promising. People are reporting improvements in their well-being, feeling more confident about managing their health, and feeling less anxious and depressed.
That's great. Okay, last but not least, let's talk about needle exchange programs, or NEPs. This is another one that has sparked some debate over the years.
Right. Natal exchange programs are all about preventing the spread of diseases like HIV and hepatitis C among people who inject drugs. They provide clean needles and a safe way to dispose of used ones. And the evidence is super clear. They work. They reduce risky behaviors like sharing needles, and they dramatically lower the rate of new HIV infections. And they do all of this without increasing drug use in the community.
I think that last part is really important to highlight because that's a concern a lot of people have.
Totally. It's a common misconception. Unfortunately, despite the science, NEPs have faced political pushback, sometimes even funding restrictions.
But even with these challenges, it seems like the number of these programs has actually grown.
You're right. Since the late 1980s, they've expanded significantly. That's because we're understanding more and more how important they are for public health. And they're not just about needles. They offer a safe space for people who inject drugs, a place where they can get information about safer drug use, access naloxone to reverse overdoses, and get connected to treatment and other services. They really build trust. Experts agree that implementing these programs, tailoring them to local communities, is a critical part of any strategy to prevent the spread of HIV among people who inject drugs.
You know, it's amazing to see this range of approaches, from very specific medical interventions like HAT to community-based programs like social prescribing and harm reduction strategies like NEPs and safe consumption spaces. They all have evidence suggesting they can be effective in tackling complex issues.
I know, it really highlights that sometimes the most effective solutions aren't the first ones that come to mind. These programs often work because they address the root causes of health problems, whether that's providing safer alternatives, encouraging healthier behaviors, fostering connections, or reducing the harms associated with drug use.
It really makes you think about the underlying principles at play here. Harm reduction, the power of incentives, social determinants of health, and building trust.
And this leads to a really important question for all of us listening. Considering everything we've talked about, what do you see as the biggest hurdles to wider adoption of these types of programs? What would it take for them to become more mainstream? And if we truly embrace this diverse range of solutions, what would that mean for our healthcare system? It really challenges us to rethink how we approach health and well-being.